Which of the following readings of arterial blood pressure is considered normal in a healthy adult? So now we might know historically that the normal textbook blood pressure is 120/80. But really, the current guidelines are now saying that this is really your upper limit, and that actually anything lower than that is considered to be good and healthy. We don't want it too low that you're hypotensive, but for just a typical average adult, if you're anything in the 100 to 120 as your systolic, which is your higher number, while the heart is contracting instead of relaxing, that is considered to be normal. So then we could say around 78/80. That's even better than your typical 120/80 because this is actually even lower, and that's better for your heart. So based on that, when we look at the choices, we see that everything except for one here is actually higher than that 120. So even worse off than what we're looking for and aiming for. So when we see in option C 130, option B 150, A 170, these are all considered too high and not normal, and actually varying stages of the hypertensive scales. So this would be considered the 130/85. According to the guidelines here, it would be considered pre-hypertensive and something that would have to be worked up and investigated to prevent any further issues with the cardiovascular system. And then similarly, option B here is hypertension stage 1, and option A, 170/100, is hypertension stage 2. However, looking at option D here, we see 110/75, which matches what we were looking at here, that anything even below 120/80 is even better. Therefore, 110/75 would be considered a normal and healthy blood pressure for an adult. And options A, B, and C would all be considered too high to be considered a normal healthy value.